President, Midwives Association of Zambia, welcome to HH1 in office.
Thank you very much.
Good to have you.
Thank you.
It's an important matter that we look at, and to give you an opportunity to summarize the work that you think has been done by government in the last 12 months, what would you be saying?
To be honest, I want to say in midwifery, very little has been done. Mm-hmm. In obstetrics.
Right. Let's talk about that.
Yeah, so the maternal mortality remains very high. Every week, we are losing an average of 16 mothers. Just last week, we have lost 17 mothers. The other week, we lost 18 mothers. And we are losing more than 600 babies per week. To be precise, the cumulative from January this year to date, we've lost 427 mothers.
That's a lot of mothers who don't deserve to die. Mm-hmm.
Those who do not deserve to die. And they are dying due to postpartum hemorrhage, which is a preventable cause, and eclampsia. So, to be honest, like I've said, nothing has been done so far. We've lost so far 901 stillbirths. When I say stillbirths, those are babies who were breathing up to 9 months, or let's say up to maybe 6 months when they are viable and they can be born live, but they were born dead. And this is just a number of stillbirths. We also have the other causes of deaths like macerated stillbirths. Those who are born, maybe they have been, for lack of a better word, maybe they are rotten in the body or, macerated. Mm-hmm. So that to me is a very big cry, because there has been no change whatsoever from last year. From last 3 years, we've been losing more than 700 mothers in a year. Right. And to date, if we are at 427, and we are remaining with the maybe 4 or 5 months from now, I think we still are going to reach 700.
Those numbers are startling. I mean, they are concerning. Yes. Because if you're indicating that it could be, there are other reports that indicate that in the last 16 years, that number was halved to about 360.
Yes.
From 700 and something.
729.
To about 300.
To about 398.
Right.
And now to 278.
That's per 100,000 births.
100,000 births.
So what are you saying now? What
I'm saying is, those statistics, yes, they are there as authentic statistics. Mm-hmm. But I'm talking about the absolute figures that we are receiving every week. We have the maternal, and perinatal review every week. So that is showing us the actual figures of women who are dying. Mm. And we may not even know those who are not reported, because in villages, when a woman dies, they just bury within the same day. Right. There is no reporting. So even the figures that are reported, those are figures that are coming from institutions across the country. But there are those community deaths in remote places which are not reported. So we can't say it may be even more than that.
So this obviously must have hit the ears of the president, because now we're told that there is a directive to have a trained midwife and maternity wing in every health facility. How is that going?
I couldn't wait to hear that one. That's a very, very good move, because just recently, with the employment of the health workers, only a tip of an iceberg was touched on midwifery. So midwives were very few who have been employed, and yet the cry is the critical shortage of midwives. Mm. We have centers, and I'm happy the president is talking about every facility, because we have facilities which are managed by community health assistants, the ones we call CHAS. Those are people who have just been trained in basic, nursing and not even midwifery. And those are the ones who are manning some of these facilities in rural areas. Go to provinces like Muchinga, you find most health posts are managed by the community health assistants. And there they will admit a woman, they don't even know what to do. They'll keep a woman, the next thing you hear is a woman has died before they even transfer to the nearest health facility.
So in some places, of course, we know that it's not easy, obviously, to give life to another being. But with advancements that have taken place in the health sector, you want to believe that it should be less of a threat for a woman to go and deliver. What does it say with regards how urgent this matter is?
The matter is very, very urgent. Because like I've said, a woman who is handled by a skilled birth attendant, I think is safe than a woman who is being handled by a non-midwife. We have so many nurses. By the way, nursing is not midwifery.
Okay.
Midwifery is midwifery. So it's a special, profession.
Has society been taking things for granted?
Yes.
To assume that the nurse would take care of it?
Yes, they think nursing is midwifery, and not just the community. Because even the Ministry of Health, for instance, maybe they think some of the human resource, or people responsible think nurses can be able to handle, midwifery, cases, which is very, very wrong. Because
Right.
when they're recruiting, they recruited a lot of nurses compared to midwives.
Right.
Thinking that a nurse who is posted to a health facility will be able to handle the cases of, women and newborn.
Right. Let's hear what Hilda has to say. Hilda is calling us. Oh, shame, Hilda. Okay, so you can get in because the window is really, really short and small. So you want to get in touch with us very quickly. So what are your recommendations? Because the beauty about this production is that it's given an opportunity to review the last 12 months in order to better the next 12 months and beyond.
Yes, so we have a lot of midwives who are out there on the streets, unemployed. Every year we have more than 1,000 graduates, midwifery graduates. And those are just roaming in the streets. Those who are like going as pre-service, the in-service at least are taken back in the service. But those who go there as first-time, midwives, they haven't been employed. So they are there out there. And if government can take this opportunity, if we are going to have every facility having maternity, then all those midwives can be consumed. Right now, we need more than 9,000 midwives in Zambia.
That's a huge number. Innocent joins us from Kasama. Welcome to HH 1 year in office. What would you like to contribute? Or what's your question? Innocent? I'm sorry, we lost you there again. Right. Let's as we close this, 9,000 is quite a number, and maybe it might be a bit, I don't know, it's possible. What would be the approach, practical approach to getting this number?
The practical approach is really to increase employment of midwives and deploying midwives at every facility. Because right now we have a number of facilities that are providing maternity services, but it's a shortage that they have. It's a shortage of those midwives. You can imagine a facility like maybe a Matero General Hospital, which has maybe more than 900 deliveries per month. Now, if those facilities like Matero can have 54 midwives working there, how do you manage? Because per night they will have maybe more than 20 deliveries. Per day they will have more than 30 deliveries sometimes. So we need more midwives. Right now, if you look at the ratio, we have 1 to 1,000 women. 1 midwife per 1,000 women. That's
1
the
to
current
1,000?
ratio. Yes. And yet the required is at least 4.2 per 1,000 women.
So to put it plain and simple, right now, 1 midwife to deliver 1,000.
That is the ratio Zambia is in. is at. So we really need that urgent employment of midwives. It's really urgent. And if we are to have every facility have a midwife or a maternity, we need those midwives to be in those positions. You know, they are qualifying, and those students, those ladies and gentlemen are just roaming the streets. Their skills are going down. Right now, the association is busy, you know, trying to enhance skills for these midwives. We are doing our best to source for money to train these midwives in the best skills, the essential skills that they need for them to handle these cases, which are preventable deaths. And these are the trainings we are carrying out as an association.
How does the government get helped here? Who can chip in? Yes, the government has a primary responsibility. Having heard this and the seriousness of these statistics, in the immediate term, what complementary efforts do you think, and from whom would you say?
I think from all stakeholders, everyone should be a concerned person, including yourself, Franklin. Everyone should be concerned, and the concern comes by because we are seeing the deaths. We are seeing how many women are dying. So everyone should just put in an effort. If it means, you know, sourcing for funds for government to pay those workers that they're going to employ, let them do so. Let them redirect resources to human resource in midwifery. And that will solve, because a midwife is the primary caregiver in obstetrics. Obstetricians are very few in Zambia, and midwives do a lot. They do a lot, really, to save lives, and we need them like yesterday.
Right. Let's see whether we can squeeze in a caller just before you go. Hello, there's Phineas on the line. Welcome.
Yes, boss.
How are you this morning?
I'm okay, and you, how are you, boss?
I'm very well, thank you very much. Please go ahead. We have the President Midwives Association of Zambia. Phineas, you have the floor. It's all yours.
Yes. Yeah, chapeni ndanda ulako, boss, eh? Hello?
Please.
Yeah, mawekazi vangapezeke vambiri ku hospital, but the challenge yamene iliko. Ife timaenda ku hospital every time. But ukafika kunja ku hospital, upeza kutati mawekazi valipize pa mafoni, sivachita atendi ma patient vamene vabwera kuja. That's why my challenge, uyenda kumazulo, uyenda 7 hours hospital, but uchoka ku 15 hours. Sivachitatendi mawekazi valipize kumafoni, kumachani, so naife timadandaula mwaona. So vamene vijanje vengesa, even ni vantu vakaondi kutatu like president, kasevenza, tumakalipa, ife venangu mbonga ife vama pipi, so sometimes tumakalipa. Valipize na mafoni, sivafaka nzeru kumawekazi.
Thank you very much. Thank you.
Kumakwara na heve futi. Vakupata iwe ndio wodwala ufuna ndalazi ulipe kopeza ndalama but vakupasa chipepa yenda ugule kwaso uzazipeza kuti we udwala.
Okay, no, I think the point is taken. So to just summarize it, luckily I can understand what he's saying. Sometimes, and we've heard these horrid stories where a mother is giving birth, and because of familiarity, the person that's supposed to tend to her is on the phone, or so again, shortages, yes, need for manpower, yes, but the attitude of some of the people responsible for taking care of mothers in those situations, as far as the public is concerned, according to what he's saying, needs to be addressed.
Yeah, I agree with him. Yes, we have such kinds of, midwives who are doing that. But now what we have done as an association, we have a program that is called Respect for Maternity Care. And we developed guidelines for the nation. So we have those guidelines, and we are doing trainings across the country. We realize that, yes, there are some midwives who have, that tendency of neglecting a woman. So in Respect for Maternity Care, it's talking about the respect that a woman deserves who has come into labor ward. A woman, who comes in labor ward needs to have that confidence in you as they come in. Yes, so when you're on the phone, I think a midwife, a woman would feel bad. And even after, if they deliver a stillbirth, then they will attribute that to what they saw in the maternity. So we are trying by all means to talk to our midwives, and midwives out there, please, we are hearing what the public is saying. Can we change our attitude? Can we look at saving lives? That is our core business. So we are going to continue, strengthening midwifery by integrating respect for maternity care, even in the curriculum that the Nursing and Midwifery Council is developing and reviewing. Every time we have incorporated respect for maternity care. It needs to be talked to. It needs to be talked about all the time, and we hope that will improve the services that we are providing.
Well, thank you very much. It's a short time that we've had. I was going to go into how much people I have to pay sometimes, 30,000 kwacha just to have a safe birth and things like that, but then maybe for another day. Thank you for coming.
Thank
and
you
the very
so
best
much.
of luck. I'm sure you get the numbers. I'm sure that something will be done.
Yes, yes, we really look forward to that. And for any concerns for the public, you are open to call my number. If you see anything, you observe anything, please call my number and I'll be able to help you. Thank you very much.
Well, thank you very much. I was hoping that you were going to shout out your number, but then...
I'll give you my card.
Okay, sure, not a worry. Well, I think what's important is it's the President, Midwives Association of Zambia, Sarah Ngoma, on HH 1 year in office.